Welcome, everyone. We're so happy to be here at the offices of the Health Department, and I know Jahangir Khattak, who's my colleague and co-director of the Center for Community and Ethnic Media, joins me in thanking Dr. Bassett and her colleagues, and Maybay, Carolina, and Chris, and others in the Communications Department for welcoming us, and welcoming all of you here from the Community and Ethnic Media. The primary purpose of this roundtable is, as you know, to focus attention on the Zika virus and the precautions that New Yorkers should take to avoid exposure to the virus. The secondary purpose is to introduce the Vital Signs Report on Immigrant Health. Dr. Bassett and her colleagues will discuss the Health Department's latest initiatives and recommendations concerning Zika. Then Dr. Sonia Angell will discuss the Vital Signs Report. They will take questions on these topics only, and we will reserve a short period of time at the end of the hour for other health questions to be addressed. The Zika virus was first identified in Uganda in 1947. And like many equatorial and tropical viruses, the vector for its transmission is a mosquito. Until late last year and early this year, it's fair to say the Zika virus drew few headlines, partly because the muscle aches, rashes, and mild fever it causes are not severe or life-threatening. But within the past year, it became apparent to public health officials, based on reports initially from Brazil, that infection in pregnant women is strongly associated with birth defects in their children, particularly microcephaly, but other birth defects as well. Microcephaly is a condition in which the baby's head is small and brain development is often impaired. This finding alerted public health officials and has trained medical researchers' attention on Zika. Now they are learning new information about person-to-person transmission. To date, in New York City, there have been 346 cases. Those are the latest data that Dr. Bassett just gave us the numbers, and 41 of those among pregnant women. None of these cases have been attributed to local mosquito bites. Rather, they have been attributed to transmission by someone who has recently traveled to an infected area. Now it's time to hear from the experts. Dr. Mary Bassett was appointed New York City Health Commissioner in January 2014 and already has had a big impact in her efforts to promote health equity and improve public health. She has more than 3 decades of experience in public health and worked for nearly 2 decades in Zimbabwe focusing on AIDS prevention interventions. Please welcome Dr. Bassett.
Thank you, Karen. I want to thank all of you for making the trek to the Health Department to join us here this afternoon, and to thank my fellow panelists. We're very pleased to be joined by Dr. Juan Tapia Mendoza and my colleague, Dr. Angell. I'm going to be talking a little bit about Zika and letting you know what I've been worrying about and thinking about as Health Commissioner as we move forward through the summer months. And then I'm going to turn it over to Dr. Angell to talk about immigration health. But importantly, before that, Dr. Tapia Mendoza is going to give us a report from the front lines of primary care and share with us some of his experiences. Karen's given you a summary of sort of the global situation with Zika. The first thing that we always have to say when we talk about Zika is that we continue to learn more and more about the Zika virus, even though it was first described over 50 years ago. So we have a virus that is largely spread by mosquitoes. All of the big outbreaks, including the outbreak in Latin America and the Caribbean, which has involved the entire Caribbean and almost all of South and Central America. All of these big outbreaks have been driven by mosquito-borne transmission. But we also now know that there is sexual transmission, and as probably all of you are aware, we reported just recently that in addition to the documented male-to-partner transmission, that here in New York City we identified female to male case of transmission. Now, because this is largely a vector-borne disease, our city has invested substantially in boosting mosquito control. And the mayor committed $21 million. A big share of that is going to making sure that we reduce the number of mosquitoes in the city, educate people about protecting themselves from mosquito bites, and make sure that we put in place a robust surveillance system. And that's all very important work, and I'd be happy to answer any questions you have about it. But as Karen pointed out, every single one of the nearly 350 cases of Zika that we've seen here in New York City has been travel associated. And among those are 41, to be precise, pregnant women who have tested positive for the Zika virus. Now, as health commissioner, I look at the data on Zika every day, and I have been concerned that we continue every single day to have clinicians call our call center and discuss the case of a pregnant woman who we agree meets the criteria for testing. We've now had over 2,000 pregnant women who met the criteria for testing, either because they had traveled to an area where there was ongoing Zika transmission and had returned to New York City, or were coming from that area and were entering New York City, or because they'd been exposed because they had a partner who traveled and they had potential sexual exposure, a less common reason for being tested. We're seeing between 40 and 50 pregnant women who every day are being cleared for testing, having their testing approved at our Zika testing call center. And I just want to bring your attention to the graph. So this is the graph of the number of cases. And as you can see, it just keeps going up. This is a source of great concern to me because for the overwhelming majority of people who are infected with Zika, it's a mild disease. In fact, 80% of people who get infected with Zika will never even know. They won't have any symptoms of their Zika infection. But the woman who is pregnant and becomes infected, it won't be her who gets seriously ill. The Zika virus can have just devastating consequences on the developing baby, the most serious of which is microcephaly. So we want it to be very clear that if you're pregnant or trying to become pregnant, that you should not travel to an area where there's ongoing Zika transmission. And that's why all of you are so important. We know that your media is trusted and read by many people who may be traveling to countries. This is July and August are peak travel seasons. Many people in New York City have roots and ties, either because they're immigrants or because of their ancestry to countries where there's ongoing Zika transmission. So let me just say it again. If you're pregnant or trying to become pregnant, you should not travel to an area where there's ongoing Zika transmission. And this is something that also applies to the partners of women who are pregnant and trying to become pregnant. Because if you're a man and you went to these areas and you left your pregnant wife at home, as we advise you do, when you come back, there are a set of recommendations that we make about how you can protect your wife from getting Zika through sexual transmission. And they include either abstaining or having safe sex for several weeks. So if you're a man who doesn't feel that you can follow this advice, we suggest that you consider postponing this travel until your baby is born. I want to see this graph level off. I don't want to see it go up every day. So and the reason is that I want to make sure that we protect babies. So that's why we're launching a new campaign. If we can just back up one slide. I hope it's pretty straightforward there. If you're pregnant, trying to get pregnant, don't fly where there's Zika. And the reason that we need to protect women is because we are very concerned about this terrible consequence of Zika microcephaly. These are the small brains and small heads that you've seen in pictures largely coming from Brazil. With the numbers that we have now, I think it's really just a matter of time before we see a case of a baby with microcephaly born to a mother who has been infected with Zika while traveling. So with that, I would like to turn it over to my colleague. Thank you very much for joining us today. Dr. Juan Tapia Mendoza is a pediatrician, runs a very large pediatric practice that serves the communities of Washington Heights and Harlem. And he has joined us today to talk about what it is to be on the front line of talking about these issues with women and their families.
Thank you. Thank you, Commissioner Bassett. And thank you for all the efforts that the Department of Health has been doing, educating the public. Because before the Department of Health came out with the campaign warning people about Zika, most of the patients that came to our clinic were either unaware that Zika exists, or many of them were already used to seeing illnesses, other mosquito-borne illnesses like dengue and chikungunya. However, a lot of the patients that I see are of childbearing age. So we see a lot of teenagers, ages 18, and young adults taken home, and they usually travel once or twice a year. So when I tell them about the importance of using protection, it catches their attention. But we still need more education because many of our patients feel that Zika is a disease that happens to people that are in the woods, or that if they go to a resort, or if they're in the capital of the Caribbean countries, that they're not going to get Zika. So it is very important for us to continue to stress that it is important that if the woman is pregnant, she should postpone travel, and also the boyfriend or the husbands, that now that they should know that even if their wife stays at home, that they can still transmit the Zika virus infection.
Thank you. So that really is the main thing we'd like to talk with you about and hear your questions about regarding Zika. But we know that the immigrant community in New York City faces many issues regarding healthcare access and the achievement of health. And we also wanted to share with you today some recent work that we've been doing regarding broader issues of immigrant health. So with that, I'm going to turn the mic over to Dr. Sonia Angell. Dr. Angell is the Deputy Commissioner responsible for a division in the Health Department called PPC, or Prevention and Primary Care. And a key part of their work has been trying to sort of link the world of public health and the world of primary care. So, Dr. Angell, to you.
Thank you. It's a great pleasure to be here today to share with you recent findings from a new report just out, hot off the press, that you have, which describes findings, data that we've analyzed related to insurance status and access to preventive and primary care services, which we realize are so important. Nearly half of New York City adults are foreign-born. That includes about 80% of Asians, about half of Latinos in our city, and about 40% of blacks. We found in our report that heart disease and cancer are the leading causes of early death in both the foreign-born and the U.S.-born. We know that health insurance is very important to address these causes. Certainly we know that while insurance doesn't guarantee access to care, it certainly helps facilitate very important resources to help people either prevent these diseases, or if they have them, to manage and control them. However, what we found is that there are stark differences in coverage of insurance for our foreign-born and our U.S.-born. In fact, we found that in New York City, about 1 in 5 New Yorkers who are foreign-born do not have insurance coverage. That's compared to about 13% of US-born. So we realize that there are very important differences in insurance coverage in the city, and that can result in poor access to care and poor health outcomes. Likely related, our survey also showed that foreign-born are less likely than US-born to receive routine primary care services. Services like getting your blood pressure checked annually, and getting your blood pressure checked is very important to assure that you don't have hypertension. Hypertension is a leading cause of heart disease and stroke, so very important to be aware of. We also found that the foreign-born were less likely than the US-born to get a flu shot in the last year. Again, a very important preventive service in our city. We've seen remarkable improvements of coverage of care in New York City. The Affordable Care Act has really changed the landscape of coverage in our city. And while all New Yorkers have benefited overall, the foreign-born included, they still have higher rates of uninsurance as compared to the US-born. That said, we're working very hard in this population to ensure that those who can get covered, who do qualify for insurance, do get covered both in the US-born and the foreign-born. But it's really important to note that there is an important subset of the foreign-born, those who are undocumented, who do not qualify for this insurance. And for that reason, New York City has taken a very important step, developing a program to help improve coverage in this population. Those who are uninsured and don't qualify for insurance coverage through the Affordable Care Act, through the New York State of Health Marketplace. The Health Department has worked in partnership with the Mayor's Office of Immigrant Affairs to launch the first phase of a new healthcare access program for immigrants called Action Health NYC. This program is for uninsured New York City residents with incomes at or below 200% of the federal poverty level, who are ineligible for healthcare insurance and unable to access insurance through the Affordable Care Act. It's designed to improve access to regular and coordinated preventive care for this population. And while it's not insurance, it does facilitate access to care through a very intentional manner. The enrollment period for this program is underway. It started in May, but it ends August 13th. And only a limited number of spots remain available in this first year. Uninsured New Yorkers who are interested to apply should call 311 and ask for Action Health NYC. 311 will assist them in scheduling an appointment with staff that can screen for eligibility and help them get enrolled in this program if they qualify. As part of the application process, individuals will first be screened for health insurance, so if they do qualify for health insurance, we'll make sure that they get into that and get covered. I want to be clear, though, that although this program will test a new model of care for those who are uninsured and unable to access care through the ACA, anybody in New York City who needs care can get care at this time, regardless of ability to pay, regardless of immigrant status. Our New York City Health and Hospitals and a whole network of community health centers provide these services. Again, call 311 if you need access to this, and you can be referred and provided services on this. I want to remind everyone that if you are pregnant, and it's particularly important in this conversation, many of you will apply, regardless of immigrant status, again, for insurance, as well as all children in New York City qualify for coverage. So again, any uninsured New Yorker who wants to find out more about Action Health NYC, or find out more about what the insurance opportunities or possibilities are for them, please call 311 and we'll help direct you to those services.
Thank you. All right, back to you, Karen. Okay.
So I'll kick off the questioning and then we can open it up. The New York City Health Department website indicates that about 2/3 of the cases, Zika cases that have been reported in New York, appear to be related to travel to the Dominican Republic. I wondered if you are doing any special outreach within the Dominican communities and working with any local organizations, nonprofits, community organizations, etc., to reach people who may be traveling back and forth between the U.S. and the Dominican Republic to make sure that they are aware of the risks.
So thanks for that question. You're referring to the data that we released a week or so ago that showed that at the time we had 233 New Yorkers who had been diagnosed with Zika, and 140 of them said that they had arrived from the Dominican Republic. So That, in part, may reflect the outreach that you asked about, that we have been working hard to reach the provider community, reaching out to specialty professional groups across the city, both pediatricians and obstetricians, including ones that cater to the Latino population of the city. We've actually sent our kind of boots on the ground approach, the community outreach teams, to provide materials to healthcare providers in communities where we know there are a large number of people who have ties to areas where there's Zika, including Washington Heights and the South Bronx, where there are large Dominican populations. The Dominican population is now the largest population in New York City of people that we class as Latino. And it is a new immigrant population. People travel back and forth a lot, as Dr. Tapia Mendoza was mentioning. And so we don't know what the data mean in terms of the fact that people are listening to their doctors, presenting for testing, all of which is really good, or the extent to which it reflects the fact that we have a lot of back and forth travel. But we are using every means we can, and we look forward to everybody here who this afternoon to help us amplify that message. To ensure that I don't want to hear you telling me that you have any woman who says that she's never heard the travel advice. And we want to make that travel advice really clear, that if you're pregnant or you are trying to get pregnant, that you should not travel to an area where there's Zika.
Okay, so questions? Yes, New York, sure.
My question, my name is Manzoor Hussain. And I work for Urdu Language Daily, Pediatrics, or the International from New York and Washington. My question is that as you are well aware that the number of people infected with Zika in the city is rising, and now we are finding that it's spreading to having sex with people affected by this virus. Your efforts to fight the disease are laudable, and surely it is trying its best to not to let it to reach the level of epidemic. Would you consider appealing to the Christian and moral values of this nation, which abhor free and promiscuous sex and sex out of wedlock, instead of calling for protective sex?
So I think everybody heard the question. And we really don't, my role as health commissioner is to ensure that people know how to protect themselves, however they choose to do so. So one way to protect yourself if you have traveled to an area where there's Zika is to abstain from sex. Another way to protect yourself is to use barrier methods, and we recommend barrier methods for both men and women because we know that transmission can occur from men to their partners and also can occur from women to their male partners. And I want to make sure that whatever the practices are of every individual in the city to whom this advice applies, that they have the information that they need so that they can protect themselves and, most importantly, their partner, if their partner is a pregnant woman, and to protect her from Zika. So the main person who I want to protect from Zika is the pregnant woman. And the reason we have to focus on the pregnant woman is because of the risk to the developing baby that this virus poses.
I'm Javier Castaño from Quiz Latino. I have many questions, but let's start with this. You mentioned that 2/3 of the cases are from Dominican Republic. What other countries in Latin America are at risk besides
A listing of all the countries where Zika transmission is occurring.
Can you repeat again which website?
The Centers for Disease Control, it's our federal public health agency, and they have a website which is at www.cdc.gov. And the best way to check what countries have been affected is by going to that website.
Yes.
Claudia Jones from the Spanish Service of Associated Press. You have mentioned that more than 2,000 women who have traveled to Zika-affected areas have been tested. The majority of, you're worried that you're seeing an increase, right, of more and more women being tested who have
Pregnant
traveled.
women.
where the majority of these women have they traveled to the Dominican Republic?
I actually haven't looked at those data. They travel to areas where Zika transmission is ongoing. And so the over 2,000 women are women who return to the United States. They go to see their doctor. And we think that here in New York City, the majority of pregnant women do go to see their doctors. Their doctor obtains a travel history, as I'm sure Dr. Tapia Mendoza would get. And then they call the Zika testing call center to get approval to submit a Zika test to our laboratories. So far, over 2,000 pregnant women have met the criteria, meaning for most of them that they've traveled to an area where there's Zika transmission. For some of them, it's their partner who traveled and they've been exposed to potential sexual transmission. And of them, 41 women who are pregnant have tested positive. So what I'm worried about is the fact that the numbers of women who are traveling, I see it every day. You know, there are 40, I think on Friday last week, there were 45 women who were pregnant and met the criteria for testing. And I want to see that number go down. I want to see fewer women who are pregnant arriving in New York, having traveled to a place where there's Zika transmission. Do you want to say anything on this? No? Okay.
Good afternoon. Issa Juf Campbell from AfricanSpot.com. I think that's theory when you tell people don't fly where there's Zika, and there's reality when maybe you have to go back see the family or you have to go there to work. So if you have to go to a Zika, an area where you might get Zika, how long after you come back you should avoid having sex or you can not transmit?
Okay, let me take your question and sort of divide it up into different pieces, because one of the things that I want to try and convey today is that our best advice from the health department is to think very carefully about what it means to decide you have to travel. And that for the pregnant woman, I hope that in most of those circumstances, she will decide that this year she won't travel. So it's the pregnant woman who we are really worried about. For most people who go to areas where there's Zika, they won't even know if they become infected with Zika. It's a mild disease if they have symptoms. And if they're not pregnant, there's no risk to a developing baby. So it really is the pregnant woman for whom we are concerned. And I really hope that for all pregnant women, that they can decide that this year they don't have to travel. And I would like to just ask Dr. Tapia Mendoza to speak a little bit about how he has conversations with women about this travel advice, because I agree that there is reality. I'm seeing it when I look at the numbers, every day with, on average, between 40 and 50 women having been exposed to Zika.
Yes, since a lot of our patients, they sort of live between Dominican Republic or Puerto Rico or other Latin American countries and New York, a lot of times they say that they have to travel regardless. Many consider like going to a wedding, that is a perfectly good reason for them not being able to postpone. However, I think our best weapon at this time is the communications. Because anytime that a report comes out in the news about Zika, we get a spike in the number of calls from patients asking about the disease, and also putting emphasis that it is a sexually transmitted disease and that you do not have to travel out of the country in order to get infected.
And then I want to answer the rest of your question, because you wanted to get some facts about what we recommend about testing for people who have been Zika exposed. And every pregnant woman who travels to an area where there's ongoing Zika transmission should see her doctor and should discuss with her doctor being tested.
And you also have on the website some guidance with respect to the number of weeks that people should
yes. Yes, thank you for reminding me of that. So for the men, and the women who aren't pregnant, who travel to an area where there's ongoing Zika transmission. We only tell returning travelers to discuss getting tested if they have the set of symptoms that are typical of Zika. There's a typical rash on the trunk, on the face, fever, joint pains, red eyes. All people with those sorts of symptoms we recommend to be tested, but people who don't have symptoms are still told that they should follow safe sex advice. And here's the advice. If you've had no symptoms and you have returned from an area with Zika transmission, you should practice safe sex, meaning using barrier methods, for 8 weeks after your last possible exposure to Zika, which for most people coming from the Caribbean will be when they left the Caribbean and returned to New York City. If you've had symptomatic disease and you've tested positive, the recommendation is that you wait 6 months before you have unprotected sex.
We get calls from uninsured patients about costs.
You get calls from, so the question is, you know, what do I need to worry about the costs of Zika testing? And the answer is that the New York City Public Health Lab does this test for free. Your provider just has to call the call center and determine with a person who answers the phone whether their patient is appropriate for testing, and we will even arrange to pick up that specimen. And because we want to make sure that the women who should be tested and the men who should be tested will be tested by their providers. So you don't have to go to a special testing location.
I'm
Yes.
from the diario. I would like to know if, besides advising pregnant women to not travel to affected areas by Zika or to their partners not to do so, I would like to know if the Department of Health is going to expand the campaign and the outreach to the New Yorkers who are planning to go to Rio de Janeiro next month for the Olympics Games, including general public or athletes.
The only recommendations about deferring travel refer to women who are pregnant and who are trying to get pregnant. It's winter in Brazil, and as you are probably well aware, the Centers for Disease Control, the World Health Organization have indicated that they will not recommend against travel to Rio, and I agree with that advice. The recommendations about deferring travel refer to women who are pregnant or trying to become pregnant. And I would extend it to their male partners if that partner thinks he can't follow the safe sex advice. So just once again, that's 8 weeks of using condoms or abstaining from sex. If you're a man who has traveled and you think when you got back, you wouldn't be able to follow that advice, then I would ask that you consider not traveling. For a man who gets symptomatic Zika, when he comes back, he's advised to wait 6 months before starting a family, for example. And of course, if your partner is pregnant, you're advised to use protective barrier methods or to abstain from sex for the duration of your wife or girlfriend's pregnancy.
One question here. The fact that it's a natural thing. 2 countries will always be in contact. Are there any plans by this New York City to perhaps work with Dominica to see, you know, what they are doing there to share notes or to collaborate?
That's a really good question, and we certainly have been in close touch with the Puerto Rican health authorities. As some of you may know, we shipped, this is a U.S. territory, and we shipped 1 million condoms and sort of solidarity and support to the people of Puerto Rico. We are in very close touch with the Ministry of Health in the Dominican Republic, and I certainly think it's a good idea that you raise.
Anything for Jamaica? Like publication? Anything for Jamaica and the Caribbean?
Well, we certainly are open to having those conversations.
So it appears that the first case of Zika being contracted in the U.S. occurred in Florida, and what does that necessarily mean for
the United States? And specifically for New York, are you doing any specific increase in efforts to fight mosquitoes? Do you have any like concrete preventive measures at this point, or?
So the first part of your question refers to the fact that the Florida State Health Department recently announced they're investigating a potential case of local transmission. They have not confirmed that transmission occurred due to a local mosquito, but the Centers for Disease Control, the CDC, has joined the Florida Health Department, and they're investigating this case. So we are awaiting the outcome of that investigation. Of course, as I mentioned earlier in response to a question, the Aedes aegypti mosquito is present in Florida and other states, and it was fully expected that, as has been seen with dengue and chikungunya, that there might be local transmission. The next question you asked is what we're doing to with mosquito control, and the answer to that is that we redoubled our mosquito surveillance. We've doubled the number of traps that we've placed around the city, and we've doubled the number of sprayings and larviciding. The larvae are the next stage after the egg hatches, and we've done already this year 3 or 4, actually 4 aerial larviciding events. So we're aiming to push down and reduce the number of mosquitoes. We've been testing for about a month now our mosquito pools, and we have not detected Zika in our mosquito population. We have not identified the mosquito that's the vector of this current outbreak, Aedes aegypti. So I remain cautiously optimistic that we won't see Zika here in our mosquito pool. I'm very concerned about travel, as you've been hearing. In order to do all this work, the mayor allocated an additional...
Journalists, do you have a geographic spread of where the people travel to who have the contact with the virus? Because when you say the Caribbean is a diverse area, and these are economic questions as well.
Yes.
So could you narrow it down and let us know where it is that the folks picked up the virus, so that when you say the Caribbean, we can know? Colleague here asked about Jamaica, Dominica, so that we can have an idea as to where these cases are coming from.
Sure. So the first part of your question, and the first part of many people's question has been, where do we have ongoing Zika transmission? And the answer to that question in terms of the Caribbean is that, as far as I'm aware, there's not a single place in the Caribbean that hasn't reported Zika transmission from its own mosquitoes and potentially sexual transmission as well. So Zika transmission is ongoing throughout the Caribbean as part of the outbreak that has involved almost all of Latin America, meaning South and Central America and the Caribbean. If you want to get up-to-date listing of all the countries that are affected, then you can look on the CDC website, where they update the information. Now you're asking another question that I don't have the answer to, and that question is, where do New Yorkers travel? What we are able to tell you is where people have traveled who enter our area airports. And those people may or may not be New Yorkers. And we looked at these data, and the numbers of people entering our airports are huge. It's, the number I recall is from Zika-affected countries with 4.5 million people, but we don't know where those people live. We just know that those are people entering the United States whose travel originated in Zika-affected countries. So we can only look at the data among people who have reported where they've traveled because they're being tested. And those data were published a little while ago, and they showed that of the 233 people who tested positive at that time, among 140 of them, they reported that they were traveling from the Dominican Republic. They may have been there for a holiday. They may have been coming from there to visit family here. They may have been people who had roots in the Dominican Republic and live here in New York City. The next most commonly source of travel from which people came was Puerto Rico, followed by Guyana, and then after that it was a whole list of countries. Among people who came to had a test submitted to our laboratory and tested positive. So I think that what you need to know as a journalist is that you can get Zika anywhere that Zika transmission is ongoing. And that is a very large number of countries, over 40 countries at the moment. And that the people for whom we're advising that they put off travel this year, that's just pregnant women. Somebody offers me a trip to the Dominican Republic, to Guyana, to Belize, where my daughter lives. Tomorrow I'd be happy to go. That is not the risk is for the pregnant woman. That's the person, or Jamaica.
Okay, out behind you.
Yeah, Robert Bernstein, Island Voice. When people travel to these affected countries, what are some of the precautions that they can use? I've been hearing like the use of sprays, but then also you have a lot of young children who travel. We're told that DEET is not a very good product to use around children. So what do you recommend?
So there are 3 formulas. So I should say that although I keep hammering that pregnant women should, you want to answer this one?
Yes.
Yeah, all right.
But first of all, for young kids, it is very important to avoid sun exposure for a long time. But however, there are recommended insect repellents that can be used in little babies, even as young as 6 months of age. But the most important thing is try to avoid areas where you have standing water. So because this mosquito can thrive in very small amounts of water. But kids can travel if need to.
So as much as is possible, you should cover your skin, wear long sleeves, long trousers, and then use an effective insect repellent. There are 4 formulations that are okay, even in children. It's really very young babies that you need to be careful about. And that the formulations are DEET, which is fine in children unless they're under the age of 3 months. Is it 3 years or 3 months?
Yeah.
Okay. And lemon oil, eucalyptus, and picaridin, which is the brand name is Skin So Soft. These are effective, and they can be used also in children. So you can also check the CDC's website for these, or our own website at the Health Department for advice on insect repellent. The other thing that, since we're talking about insect repellent, and I know it's the last thing that that I can tell you, is that you should tell your readers that it should be the last thing that they put on their skin. So that they should always remember that if you put on sunblock, as Dr. Tapia Mendoza is recommending and reminding us is important to use no matter what your skin tone is, that you should use your lotions, your sunblock, and the last thing to go on should be repellent, and that you should have to put it on throughout the day. Stay in areas that are screened, and if possible, areas that are air conditioned. And of course, we need to know about standing water. The public has been great. You all have been great in getting the word out about letting us know about standing water, and our 311 calls are way up on that. I'll turn it back to Sharon.
We can take one question if it's about the Immigrant Health report. Otherwise, no, we are done.
Thank you, Doctor.
Is that a question about Immigrant Health report? Excuse me? No, about Immigrant Health. Anybody? No. Are you distributing copies of the report here or online? Do you have an Immigrant Health report? Is it about Immigrant Health? No. Well, thank you so much, Dr. Bassett, Dr. Tapia Mendoza, and Dr. Angell. And thank you to everyone at the Health Department, and thanks for coming.
Thank you all.